Quebec is changing how it tests for cervical cancer. It is now increasingly using HPV molecular testing as the primary testing method. Dr. Donald Vinh is an infectious disease specialist at the MUHC. Hi, Don.
Hi, Mitsumi.
So, Don, we often confuse HPV with cervical cancer. HPV is sexually transmitted, not a cancer. So what's the difference, and how is it that one can lead to the other?
Yeah, so when we talk about HPV or human papillomavirus, it actually isn't just one virus. It's actually a large family of viruses that are extremely common. And like you said, it's so common that most sexually active people are going to be exposed to it at some point in their lives. Within this HPV family, there are two broad categories. Low-risk HPV types, which can cause conditions like warts, but they do not cause cancer. And then you have the high-risk HPV types, which are the ones linked to cancers, including cervical cancer. So the good news is that most people, the immune system clears HPV infection naturally within 1 to 2 years. The problem arises when a high-risk HPV infection persists over many years. That persistent infection can gradually cause changes in cervical cells. First, what we call low-grade abnormalities, then potentially high-grade precancerous lesions, and then over 10 to 15 years or more, if it's not detected and treated, cervical cancer. So HPV itself is not a cancer, but long-standing infection with high-risk HPV can lead to it.
But up until recently, the pap smear was a standard screening test. So what was the pap test for, and why the change? Were there limitations on the pap test?
So the pap test has actually been in clinical use since the 1950s. It's a cytology test, meaning it looks at cervical cells under a microscope to detect abnormal or precancerous changes. But it doesn't detect HPV itself. It looks for the cellular damage caused by persistent HPV infection. And certainly while the pap test has saved many lives, it can miss lesions because it depends on proper sampling and interpretation. And fundamentally, it detects changes only after they've already started.
So now Quebec is moving to HPV molecular testing. So what is it that HPV testing can detect that the pap smear might not?
Yeah, so HPV molecular testing shifts the approach to screening. Instead of looking for abnormal cells after damage has occurred, it looks directly for the DNA of the high-risk HPV types, like HPV 16 and HPV 18. Because persistent high-risk HPV infection is necessary to cause disease, this molecular approach identifies the risk earlier, before abnormal cells are even visible under the microscope. Large studies have shown that it's much more sensitive than cytology for detecting high-grade precancerous lesions, which is why Quebec and other provinces are moving to this model. But a good news also is that a negative HPV test is reassuring because if you don't detect high-risk HPV in the lesions, then you can safely move screening away for every 5 years. And in some provinces, I should add, people can even collect their own sample at home for HPV testing, which further expands access to screening. So this HPV molecular test really is a game changer.
But is HPV the only cause of cervical cancer, or are there other risk factors that play into developing cervical cancer?
Well, persistent infection with a high-risk HPV type is absolutely necessary to cause virtually all cervical cancers. But that said, other factors influence who acquires or retains the virus, such as number of sexual partners, unprotected sex, early sexual debut, smoking, and immune suppression. So these factors don't cause cervical cancer on their own, but they increase the likelihood of acquiring HPV or failing to clear it.
And Don, there are vaccines available to protect against HPV infection. How effective are they in preventing cervical cancer? Who should be getting vaccinated?
So HPV vaccination is one of the very few vaccines that actually prevents cancer alongside the hepatitis B vaccine. Clinical trials and large population studies show that the HPV vaccine is over 90% effective at preventing precancerous cervical lesions. Countries with high vaccination coverage have seen major declines in invasive cervical cancer, especially when the vaccine is given before exposure in early adolescence. In Quebec, HPV vaccination is offered routinely through the school-age program to preteens, as well as a publicly funded access for certain older age groups and individuals at higher risk. But HPV vaccine can stop cancers before it starts. So it really, truly epitomizes the beauty and the power of science.
Okay. Thank you very much for this, Don.
Thank you, Mitsumi.